Hola, namaste, Jambo, ni hao. Hello, everyone. We hope that wherever you are in the world at this time, you are healthy and safe with your family, your friends, your community, doing what you love to do and advancing, prosperity and peace, inclusion and worldwide. We're very grateful to Anand and all the curators of Davos Worldwide, which I guess includes me, but really to that team for assembling this phenomenal last few days or day, and now this day and the next days and so forth, continuing the long tradition and future of Davos Worldwide and bringing incredible programming. As I think so many of you know, my name is Dr. Sanjeev Kagram. I'm currently a Distinguished Visiting Fellow at Stanford University, Dean Emeritus and Foundation Professor of Global Leadership at the Thunderbird School of Global Management. Besides my academic roles, I'm involved in lots of policy work with the World Bank, international organizations, and as well as involved in a lot of new sustainable enterprises. I think Ken's having a little challenge with the feedback there. Just want to make sure that that works out okay. But as I finish wrap up, one of the Ken, I don't know what this, you got it? Okay, I think it's getting feedback. Thanks. Okay, I'm gonna see if I can invite you and ask questions as well. So we're gonna do our best with technical difficulties that we have. Ken, I'm gonna go off and go on mute after I ask your question. Basically, it's can you say a little bit about your personal background and what led you into global healthcare and medical technology? I went on mute. It can't be. Are you on multiple Zooms at the same time, Ken, with the platform? You might be still in the other meeting. You might be in as a participant. And then while Ken's working that out, let me just say, um, one of the areas that, of course, Davos Worldwide is advancing is global healthcare and medical technologies. Are we good, my friend? Okay, there.
Sorry about
Excellent.
that. I
That's
didn't realize
okay.
it.
You were listening to all the great stuff out there. And obviously, health for all is a huge and massive issue. Um, and we want to talk today to Ken Flechler, who is the CEO of a great new enterprise venture called Heal All. But before we do, as you know, I like to do is start with a person's personal story. So Ken, just share with everybody a little about your own personal background, the evolution of, your career and how you got to Heal All without saying the story of what Heal All does just yet.
Great. Great. Well, thank you, Sanjeev. It's great to be here. I've been listening the last day. I mean, it really has been very impressive. I've learned a lot and excited to participate in the meeting. My background really kind of started. I grew up in Louisville, Kentucky. Started for a company was TKR, which was a partnership between Knight Ridder and TCI that dissolved, and then went to work for TCI. So I had an opportunity to work for John Malone, which was really one of the pioneers in the telecommunication space. TCI ended up getting sold to AT&T Broadband at the time. I joined a little company in Philadelphia, which is now a big company called Comcast. Was the head of compliance and also sat on the M&A team. We did 70 acquisitions in about 6 years, and I was on the implementation team as well, responsible for training about 800 people and about a $100 million budget annually. Um, and then after that, I joined a company called Pike Electric. And so Pike Electric out of North Carolina, I left the telecom space and joined the energy space. And I was the chief administrative officer. So I ran our international operations and then all of our back office operations in the U.S., including our new technology platform development in California. Um, After that, I had left and retired for a little bit, and there
It's
was
a
a
common theme, as you know, a lot of retirement. That's not really
yes,
retirement.
yeah. So I retired, stayed home. I sat on the South Carolina Energy Commission as chairman under Nikki Haley. Was there as my kids grew up a little bit, and then when they went back to college, I received a phone call from Bob Dudley asking me if I'd help him in this little company called Heal All.
And that's a perfect segue. Say a little bit more about Bob's. how did he go, Bob Dudley,
Sure.
for everyone to know, the former CEO of BP, longtime oil, gas, energy leader globally. He stepped down, also ostensibly in retirement, but
Mhm.
had a inspiration, an idea that he wanted to take forward and a set of values, and he invited you to join. So a little bit about the story of the founding and the creation of Heal All.
Sure. When he was at BP, they had an issue with transportation of injured employees off of oil rigs. And so one of the ideas that was implemented was taking the components of an ER and putting them onto an oil rig. And then that allowed them to decrease the transportations off. And transportations from an oil rig varied between 50 and $300,000 a transport. So it was significant savings at a time that they needed significant savings due to the oil spill that occurred in the Gulf. But so he took that kind of the idea, and then after he retired, he was really upset with the U.S. healthcare system that we continue to decrease in outcomes, life expectancy, and we have double-digit increases in cost. And he said, I'm an entrepreneur at heart. This is an issue. I could do something. So he created a company, beta tested it in North Carolina at 12 facilities, nursing home facilities, and we were able to achieve between 60 and 80% reduction to the ER. So the cost differential, we're running 8 to 9% of the cost of what an ER visit would be. So they had significant cost. The problem was the platform really wasn't a scalable platform. It was a proof of concept. So he reached out to his friend Mukesh Ambani, the head of Reliance in India. I think he's the fifth, or is it the first richest person in India and the largest company in India as well, Reliance. And so Mukesh made an investment on behalf of Reliance into the company, and we rebuilt the platform. And so by rebuilding the platform, we also continue to do data testing with the Veterans Administration in one of their facilities and still achieving between about around 68% reduction in transports. And that really, for a facility of 120 beds, you're talking about 37 to $50,000 a month, which is really significant money for a facility of that size.
Yeah. It's an incredible kind of uh, creation story, sort of evolution story, emergence story. So you have these incredible co-founders, sort of board members, investors in Bob Dudley and all he's done, Mukesh Ambani. You're kind of born global, even though you're focusing in many ways on the US as an initial, obviously massive market with lots of issues, a lot of opportunity to make a difference. You have a Indian multinational, one of the largest in the world, like you said, behind you. So you're going to scale. But I think one of the first things I want to ask you about the model is people are going
Mhm.
to immediately think telehealth. And,
Yeah.
and how is Heal All, going well beyond what people think of in their minds, mental model, telehealth?
So the real difference is we're integrating diagnostic equipment from the very beginning. So I would say about 85% of the area that you can get into a normal ER. It's just not calling the doctor and describing your symptoms. We have an EKG, we have an ultrasound or a otoscope, we have a stethoscope, and a vital signs machine on the unit, in addition to blood testing and urinalysis. So our objective is within 30 minutes from the first call to that they would be able to have the results back from the blood or urinalysis, have the testing done, and actually provide them a treatment plan within 30 minutes.
And
And
it's
so
remarkable. So it's well beyond telehealth because of the diagnostic. We're not just calling up our
yes,
nurse or doctor and getting it,
right,
but it's also a different model in the sense of it's not just direct to consumer, right, Ken? It's
right,
really working with a
yeah,
set of institutions. Talk
absolutely,
about the institutions, the partner,
yeah.
organizations, government agencies, businesses that you work with and engage with.
Sure. Yeah, and absolutely. We're a B2G and a B2B. We don't fight over consumers, but because we want to engage businesses that believe in the mission, that actually have skin in the game as well. So the first area we did were skilled nursing facilities, both private and government. So the VA is a government, and then the private ones that we've been in as well. The next area that we're looking at is prisons and correctional institutions because there's a significant cost to transport outside the walls. And so there's one state that we've been working with just by implementing it overnight. It's a smaller type of state. They're thinking they'll save $3 million a year in direct cost just almost immediately. Outside of that, we're looking at rural areas. So we're partnering with a couple of associations of rural clinics, and we'll put up like a mini clinic that could be staffed by all the way down to an EMT to run the equipment. So it doesn't even have to be a nurse. It could be an EMT that runs it out of a fire station. And so if someone is not feeling well, they could come there and you could do initial diagnostics before you would have to transport them or determine, do you need to life flight them or could you just stay at the facility? And then we're integrating all sorts of other technologies. We're integrating wearable patches. So if you were to have a fall and they would say you need to be monitored for the next 3 days, instead of sitting in a hospital bed for 3 days, we can put a patch on you and monitor your vitals 24/7 from anywhere you are. So that technology is integrating in. And then there's the next step, which we've always talked about, was the AI component, which is just growing over and over again.
And we're going to come back to that in a second. So this is an exciting model. It's diagnostic. It's B2B, B2G, B2O. It's a institutional relationship. Obviously, then individuals benefit tremendously. The example I always think about, as you know, Ken, and many people know, I have an elderly mother with advanced dementia. Um, she's lost her capability to speak English. Increasingly now, she can hardly speak our own language. I'm her POA. And so, and many people around know that I travel a lot. So something happens to her. I always get calls and say, we just want to take your mom to the emergency room, which of course is a disaster. So maybe to make this very kind of crystal clear in people's minds, how does Heal All help my mother and me to make sure that she gets, great care without, going through and sometimes trauma of going to an emergency room?
That's a great question. One of the other components that was asked for as we developed this platform out was to integrate the family in. So as soon as we get the call, wherever you would be, you would get the call as well. So you'd be able to participate from your phone. You'd be able to see the diagnostics, participate from the second that our nurse and clinicians come on board. And then also we found not only does it help on the clinical side, but it helps on the patient side because then should there be a language barrier or should you say something come up and they go, well, that's happened 6 times before. Like you should be looking at this. Our clinicians don't, as anybody in the emergency room, they don't have your history. So what we're also doing is integrating previous histories, but having that family member on board really helps with the clinical treatment that we're providing.
It's remarkable. And so maybe you could give one more example. You mentioned a little bit about, how you work, let's say, with prisons, not
Mhm.
just here in the United States potentially, but
Yeah.
all around the world.
Yeah. So what we would do is prisons are in the U.S. are required to have a doctor that works during the day and nurses 24/7. The doctors usually will at nighttime say just transport the person to the emergency room. And I don't know if you've ever been in a correctional institution. Most people there, they're trying to get out. Like they want to get out and they want to go to the hospital just because they're bored. And so one of the things that we're doing is by implementing this in, it actually decreases the amount of effort put into, hey, faking something because they'll have a diagnostic in the nurse's room determine that, oh, they can go back to their cell rather than it needing to be transported. So we're working through this right now, but we're expecting over 50% reduction in transports in the prison. And some of the prison, transports requires up to three full-time people to transport with them.
Right.
So, and
It's
Yeah.
remarkable, you know. So let's go back to the tech part. But I guess, my principle, Ken, and many people do. I believe we're in a world where we want to do high touch, high tech. In many
Yeah.
ways, Heal All is kind of the model citizen of high touch, high tech. Talk a little bit about that combination, just to reinforce,
Sure.
because a lot of times people, again, with their telehealth model, they think, oh, I get no personal care. I have no person helping me out. I got no physical contact. And second, you sort of intimated, harnessing AI. Obviously,
Mhm.
this is the world we live in. What are the different ways that you are and will be, across the value chain, so to speak, of Heal All, from the care itself to the back end and so forth? How are you harnessing AI in particular?
So, absolutely. AI is a critical part of our future. I just attended with you a conference last week at Stanford, and it really, every time I attend any event on AI, it opens up my eyes to really how far back we are, but really how quickly we need to get up to speed. And the one thing for us is with healthcare and AI, it's all about trust. It's all about, do you really trust the AI?
Yeah,
So right now we've started implementing AI on the coding side, on the billing side, to ensure our codes are correct,
yeah,
that we are capturing the right data for insurance and payment and reimbursements. And by doing that, we've actually found that we're able to get higher reimbursements from insurance companies and CMS than we were then, and the skilled nursing facilities don't have to cover those costs
yeah.
because of the way that it's being written and the AI assisted. We're able to get those costs covered. The next thing we're looking at is helping with treatment plans, being able to take all of the data through an EMR system. So a person in a nursing home or a correctional institution will have their history. Not only will we look at it, looks at what's occurring at the moment, it looks at the entire past and then gives the practitioner ideas on a true treatment plan. And then, obviously, in the future, it'll get into more of AI driven treatment. And so, with, if you have a sore throat, you talk to your AI, maybe flash your camera inside, and it's, all of a sudden you're able to get a prescription for a Z pack.
Yeah.
We're not there. And I don't think people want to trust the AI quite there yet. So we're using AI assisted as we grow. But we're definitely looking to implement that, especially abroad in countries like India. One of the areas that we're looking at is creating a standalone kiosk where people can come in and get healthcare. And it would be a free healthcare if they go through the kiosk. It would be tied back to clinicians, but there would be a lot of AI driven in that.
So that's a perfect segue to, as we said, kind of the company was born global with its kind of
Mhm.
co-founders, Bob and Mukesh, were global people from different parts of the world, great friends, great partners. Obviously yourself, a global person that's, launched and scaled, ventures all over the world, but also healthcare is global. I mean, the president of the
Mhm.
World Bank, Ajay Banga, one of his major priorities is, a massive, scaling up of healthcare, harnessing new technologies. So you sort of intimated on the kiosks, say maybe a little bit more about that use case in India, but some of the other ways that you started to explore with other partners around the world, the Middle East, Africa, other places, ways that Heal All can really serve populations all over the world.
Yeah, sure. One of the areas I spent a lot of time is in Tanzania. We had a long project there, and so I had the opportunity to spend months and months within the country, and really kind of fell in love with Africa and understand, the geographic expanse of the continent. Um, and needing to put healthcare in these local communities. So one of the areas that we're looking at is, possibly putting them in post offices. Every little community has a post office, integrating that platform. Um, and then each area may be a little different as we implement. Some people may trust AI a little bit more to be AI driven care, where others may be more clinical care. Some countries, like the US, have a real problem, shortage of nurses and doctors. Other countries in Africa don't have that issue. So, being able to provide those clinical staff with this remote treatment also helps develop. those clinicians within the country. And then, anywhere there's really a remote area or a cost of transport. So we're looking at I live in South Carolina. One of the areas that they're talking about is in South Carolina, it's not the geographic length, it's the just the traffic.
Yeah.
So outside of Charlotte, they're saying, well, we should put one here because it just takes you an hour and a half to get somewhere.
Yeah.
So, what they're looking at is that hour time frame.
Mm.
So,
So exciting. So, obviously as a entrepreneur in the early phase, in a very rapid scaling up out of an early phase, you got to focus and you got to, implement with precision and discipline. But the exciting thing that you've shared with me and many people is that there are many other add-ons, right, that could come building on the kind of asset base, the platforms that you're setting up. Share a little bit about that, whether that's for disasters and disaster response or personalized home care with, the
yeah.
briefcase, I think something you were telling me about a
Mhm.
briefcase, some of those
Absolutely.
exciting, future potential opportunities.
Sure. So right now we're working with our partners at Reliance in developing two platforms. One is if you ever been to a music conference or a concert and see that they move musical instruments in these boxes, it would be a box that you could push into a remote first aid tent and open it up, and it'll have a lab. It'll have the connection, so you could place that anywhere. And then we're actually coming out with a briefcase version that could be used for home health nurses and hospice. They could take it to the house. That would have the diagnostic equipment in. It would open up and have a screen on one side that connects in, and you're talking to the doctor, providing the data back and forth. And that nurse or the person from hospice also has access to their previous full electronic medical record so that
Yeah.
they can work through all of it, make sure that they're adding to that record. And all that also includes adding in the family. So, should you have a relative that's at home, a family member can participate in it from anywhere in the world.
Mm, remarkable. Two last questions before we wrap up, Ken. One is, um, you know, as you can imagine, fairly or unfairly, there would be some skepticism. Bob, I know
Mhm.
him well. He has deep integrity. He's a great human being. Mukesh, of course, as well. But these are wealthy, powerful individuals. They've made a lot of money doing lots of different things. You know, People are like, oh, really? They're going to be in healthcare too? Is that a good thing? And so share a little bit about the underlying values, the kind of core integrity of, their approach to heal all in particular.
Sure. I mean, as you get older, I think you get more humanitarian. And so later in life, the next dollar really isn't the driver, it's really your legacy.
Yeah.
And I think these two gentlemen are really looking at their legacy more. One of the first things that they told me when I became CEO, it's okay, to lose money. It's okay, as we go through this, do the right thing. But they really care about their reputation and their name. And so at the end of the day, it's all about, doing the right thing, making the hard choices, and they're not looking to pull dollars off out of the company. They reinvest everything in there to continue to expand. And they also said it's okay to leave a couple dollars on the table, make sure everybody's feeling good. And obviously, there will be equitable pricing in different areas. It's going to be cheaper to do it in Africa than it is to do it in the US or France.
Yeah.
Um, and so, they're looking at making the impact and then making the change both within their countries and globally.
So I lied. I have two quick ones and then we'll finish up. We have a great community here at Davos Real Wild, thanks to the leadership of Anna and the team all over the world, family offices, nonprofit NGO leaders, government leaders, all sorts of folks from different sectors. What would you want? What is there an ask you have of them in terms of partnership, of engagement, of what Heal All might want to work with them on and build?
Yeah, absolutely. The network's immense. It's global. We want local partners. We want partners that are committed to our vision. And it's obviously of the last day. the partners who are attending and the speakers are all committed to that vision. So I think, while we may disagree, they may do oil and gas, let's find a common area where we can work together and make a change to the world. And so I think healthcare is really one of those areas where no one's against it. I mean, we want to reduce cost, we want to increase accessibility, and we want to increase outcomes. I mean, there are three things that I think
That
even
we could all
even
agree
members
on.
of the U.S. Congress maybe agree to it.
Let's hope. If you had a magic wand, Ken, and you could change one thing to really accelerate this vision of, greater access, inclusive access, lower costs, better outcomes, what would that be? What would you use that
I,
magic wand
I,
for?
the biggest hurdle to everything, of course, is regulatory environment. There are regulations that are outdated and old, and no one wants to change them. They just want to add to them.
Yeah.
It's in the US and abroad. And so, having the ability to interact with policymakers to make quicker changes to adapt, because as we talked just a couple minutes ago, or a little while ago, technology is increasing at a speed a lot quicker than anyone's thinking it is.
Yeah.
And so when you're writing rules and policies, you need to be adaptive to really make a change to help people.
Then let's end with this. We started with your story. Why does this mean so much to you personally at this point in your career?
So, you know, I've been in communications, I've been in energy, and both have helped people. And I really got to see the impact of energy in communities throughout Africa
Yeah.
and how it would change an environment just by putting a power line and a couple drops into a community from a school. I mean, reducing criminal activity to, a person opening up a shop and increasing commerce.
Or
And,
improving a health clinic.
and then lastly was improving healthcare.
Right.
So I wanted to make an impact. If I was coming back into the workforce, I wanted to do something that I could make an impact on. And healthcare is one of those areas that I realized that you can make an impact almost overnight.
Well, in this world that, we sometimes call the poly crisis with all the geopolitical and domestic polarization, the planetary limits and challenges. So obviously, we're on the margins of COP30, these technological disruptions. This is a great story. This is a great venture. And thank you for being such a great leader, Ken. We're really
Thank
grateful to
you.
have you with us. All right.
Thank you. And
All
thank
right,
you.
everyone. All around the world, we wish you the best. Stay safe and healthy. Please keep joining on this incredible set of seminars, panels, fireside chats with Davos Worldwide. We'll see you again very soon. All the best.